we look at the pediatric orthopedics area, at birth, because of shallow acetabulum, we have a condition called as developmental dysplasia of hip. Its investigation of choice is MRI, screening tool is ultrasound, and on ultrasonography, the alpha angle decreases. This is what you should remember. The treatment of any hip disorder is basically what? Maintain the hip abduction. If you maintain the hip abduction, the hip gets reduced normally. So, reduction on abduction is the key word here. Also remember one thing, that DDH is a condition which is congenital. But if the hip condition comes from 4 to 8 years, painless limb in a child, that's called as Perthes. It's an avascular necrosis of femoral epiphysis. And when between 11 to 20, because of hormonal disorder in obese, overweight child, the epiphysis and the metaphysis relationship is disturbed. It's called as slipped capital femoral epiphysis. This has to be reduced and fixed. So, basically in all these conditions, with time it can resolve. The most common congenital anomaly in India is CTEV, called as club foot because it resembles the club, which is scored by Pirani sign. Remember two things. Ball and socket joints, when they are damaged, two movements which are lost are abduction and internal rotation. If at the hip and shoulder abduction and rotation is normal, it means they are normal. So, here the examiner is trying to show internal rotation because the leg goes out but the hip goes in. This is very, very important. External rotation is not very important. Although the leg goes in, the thigh comes out. DDH, right? There is shallow acetabulum, small epiphysis, Shenton's arch is broken, vascular sign of Narad positive, suprolateral is the displacement. In DDH, if you try to do the signs, there are two signs. Ortolani means reducing the hip, means reduction by abduction. O, reduction by abduction. Ortolani is a test of reduction by abduction. Ortolani, hip ko andar lana, right? Bahar lo, dislocation on adduction, bahar lo. So, these are the two tests for that. All right. Now, what you need to remember is in DDH, you can give a Pavlik harness, all right, or a Von Rosen splint. Von Rosen views is for DDH, Von Rosen splint is for DDH, or you can give a bachelor's cast. They all are on the same principle, abduct the hip. Whereas you have avascular necrosis of femoral epiphysis, age group of 4 to 8 years, all right. You can have lytic cavity in the epiphysis or metaphysis, or you can have at the upper end of femur a sagging rope sign, or you can have a crescentric sign. It all means there is a vascular insult. Treatment, maintain abduction, 4 to 8 years, painless limb. Investigation of size DDH, MRI, Perthes, MRI. Then comes if your sternocleidomastoid, sternum, cleidoclavicle mastoid, this muscle, all right, undergoes shortening, you have a torticollis or a wry neck. It is not necessary to be present in the first 3 months of life. Majority of the cases, 90% they disappear by 1 year. All right. The ear is towards the shoulder, the chin opposite. All right. Along the cervical spine, normally the segmentation occurs. If the segmentation of the cervical vertebra does not occur, it is called as Klippel Field syndrome, which has low posterior hairline, restricted neck movements, and short webbed neck. It is associated with short high scapula called as sprangial shoulder. Pseudohypertrophy of calf is a feature of Duchenne's muscular dystrophy. Duchenne's, right? Muscle dystrophy is a dystrophin gene mutation, which is the largest gene in human body, which has a proximal muscle weakness. The patient has difficulty in getting up from the ground. He uses the support of his own body called as a Gower's sign. All right. Rocker bottom foot means that there is vertical talus. Normally the talus is horizontal. So, there is a vertical talus and it looks like the toy. So, that is rocker bottom foot. Rocker bottom foot will occur if you do not treat CTV in the correct order. What is the correct order of treating CTV? CTV is a component of 4 deformities, which are remembered by the mnemonic cave. So, what is there? There is equinus at ankle, varus or medial rotation at the subtalar joint, adduction or a medial rotation of midfoot and forefoot, and increased plantar arch called as cavus. So, first to treat is cavus, that is plantar arch, then the adduction, then the varus, then the equinus. If you don't treat it this way, the CTV or the club foot, you will lead on to rocker bottom foot. This is the club, which means the CTV. This is a golf ball on a tee. That's how a shoulder relationship is. A large ball, this thing. So this photo describes two things, a club foot and a shoulder joint, just to explain you that, right? So in CTEV, you have a large lateral border and you have a small medial border and tight medial structures. The aim is to equalize both the borders, all right? So how do you do that? At birth, you apply manipulation and cast. You do it up to 1 year. The cast is supposed to be above the knee and you change it every week. This is the method of treating CTV, which is very, very important. This is the Ponseti method. If it doesn't correct by this way, right, between 1 to 3 years, you will release the soft tissues on the medial side called as a turquoise method. Beyond 3 years, since you have a varus foot, you will take out a wedge of a bone, more on the lateral side, less on the medial side, right? This is called as soft tissue release plus lateral column shortening. So soft tissues are tight, you will release them. At different ages, you do different procedures. Like between 3 to 8 years, you will do Evans. So you will do a wedge resection like this. Beyond 5 years, right, you have to correct the heel independently. So again, the same thing, more on the lateral side, less on the middle side. All the varus deformities are corrected the same. If you go beyond 8 years, then you take out the multiple tarsal bones wedge. Or if it is beyond 10 years, more than equal to 10 years, you will fuse the joints, that is talonavicular, talocalcaneal, calcaneocuboid. So calcaneocuboid, talocalcaneal, talonavicular. And talonavicular is the most difficult to fuse in CTEV. Once you have corrected CTEV, at the daytime, a child will wear CTEV shoe with a straight medial border, with outer shoe race, with no heel. And at the night time, it will apply a Dennis Brown splint so that the correction is maintained till what age? Till the age of 7. All right. In a childhood injury, you can have 3 types of injury in a bone: a deformation with no fracture, just the buckling of the cortex like the buckle at the base of a Roman pillar called as a torus, or fracture of one of the cortices with a bending of the other called as a green stick fracture, right? There are certain deformities that one should be aware of. Anterolateral bowing of the tibia is congenital pseudoarthrosis of tibia. It's an intraoperative diagnosis treated with stabilization and grafting. There can be absent axis of one of the limbs. That absent axis of one of the limbs means the radial hemimelia, means the radial side is absent, thumb is absent, the artery is absent, the vessels are absent. This is called as a radial club hand, all right? Or the fibula can be absent with short feet, less number of toes, or the tibia can be absent with tibial hemimelia, or there can be a self-resolving condition called as posteromedial bowing. So these are the conditions which you should know. Hemimelia means that half axis is absent. Now, when you have less development of one part of the radius, right, it is called as maid lung deformity. So maid lung deformity causes prominence of the lower part of ulna. It is seen in Turner syndrome. 50% cases are bilateral, more common in females. Functionally, it's almost normal. And my friends, a spot diagnosis fusion of two fingers or digits is called as a syndactyly. So this is all about the quick revision in English that I wanted you to know. And to further enhance, I will suggest you can go to the English version also, so that you are able to brush up your knowledge in a quicker way in a different language. Thank you very much.